Good afternoon, and thank you all for joining us today. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and County Executive Crowley, we'll start with you today.
Well, thank you so much, Catherine, and good afternoon to everyone. So today I'd like to begin by reminding everyone that the Milwaukee County Senior Centers will be reopening next week on Monday, May 24th. We're really excited to start serving our elderly populations again and offer some safe places to socialize and receive crucial services. And our Milwaukee County Department on Aging will continue to reach out to many of our customers to inform them of our facility's code of conduct and to share the COVID-19 guidelines in our senior centers. And we are committed to the safety of our residents and will continue to monitor and practice safety measures that mitigate COVID-19. And COVID has really intensified feelings of stress and isolation for many people throughout our community and at the nation at large. And so we know that addiction thrives in isolation, and that shows in our numbers locally. In Milwaukee County, we have seen an increase of by 30% in drug overdose deaths compared to 2019. And we anticipate an even higher increase if trends continue for the rest of this year. And just yesterday, the Milwaukee County Medical Examiner conducted 6 autopsies for probable drug overdose deaths. And when you look at these numbers are concerning. And because of this, Milwaukee County is embarking on a communication effort to normalize conversations around addiction. We want to encourage families and friends to check in on their loved ones who may be struggling and to point those trapped in opioid misuse towards some help and towards some recovery. So if you or someone you know may be struggling with an opioid addiction, please call the Milwaukee County Behavior Division Crisis Line. That number is 414-257-7222. Again, 414-257-7222. It is free to call and you'll be directly connected to someone who can help. And then lastly, I'd like to take a moment and recognize May as Asian American and Pacific Islander Heritage Month. And throughout the last year, hate crimes against Asian Americans have increased by nearly 150% in some of our largest cities in the nation. And racist rhetoric about the coronavirus has really led to the misplaced hate and blame. And so throughout this month and every month, we must celebrate the history and contributions of Asian Americans and Pacific Islanders, not just locally, but nationally. And so for the first time here in Milwaukee, we're celebrating Asian American Restaurant Week this week. And the local organization Elevation is sponsoring the event. And you can visit their website to view a list of local Asian restaurants to support. And I'm going to spell out their website for you. So the website is ELEVASIANWI.com, elevation.com. Again, ELEVASINWI.com. So we want to encourage everyone out here to celebrate the diversity in our county and throughout our city as well through the delicious Asian American Pacific Islander cuisine and by learning more about Asian Americans and Pacific Islander heritage. And with that, I'd like to hand it off to Mayor Barrett. Mayor Barrett.
Well, thank you very much, County Executive Crowley. I appreciate the partnership that we have developed on this issue. Good afternoon, everyone. Not surprisingly, there have been many questions flying our way over the last 4 or 5 days about the state of the mask ordinance, the state of the order here in the city of Milwaukee. And I've had the opportunity now today and yesterday to speak with Commissioner Kirsten Johnson and her staff to discuss the next steps that we will be taking. As you may recall, just to recap, last May, the health commissioner issued an order. That order remains in effect until it is rescinded. And that is what we will be announcing, that effective June 1st, that order, moving Milwaukee forward public health order, will be allowed to expire. We had talked about this order as recently as last week, ironically, because early Thursday morning, we announced that we were going to have the order expire on June 15th, but it was literally hours later when the CDC came forth and announced that vaccinated people no longer need to wear masks. And that's when we started the process of implementing the expert advice to determine how the city of Milwaukee will move forward. So again, just to make sure that the announcement is clear, we are moving up the expiration of the Moving Milwaukee Forward public health order by 2 weeks. It will now expire on June 1st. And with that, the city's requirements for masks will also expire. The reason it will expire is that the ordinance that was adopted by the Common Council that I signed into law tied that into this health order and said that it would remain in effect as long as the health order would be in effect. Again, today with the announcement that that health order will expire on June 1st means in effect that the city's requirements for masks will also expire. I want to put a big exclamation point and emphasis point on this. From the outset, I have been very, very proud and I have pledged to follow the science and the evidence. So when the Centers for Disease Control announced that vaccinated people no longer need to wear masks, I felt, as did the health commissioner, that just as we have at every critical point along the way, followed the CDC guidance, we would continue to follow the CDC guidance. And in a moment, Milwaukee Health Commissioner Kirsten Johnson will provide some more details. But I want to make a couple other points. I think an obvious question is, why June 1st? Why not today? Well, first, individual locations such as businesses, schools, stores, and event spaces can continue to establish their own masking requirements. So we are offering this upcoming 13-day period so that they can determine what's right for them. These businesses, these establishments, they know their client base, their customer base, their user base better than anyone. And we all know that the CDC's announcement was a very, very much a surprise announcement. We want to give these establishments 13 days again to decide what's right for them. The second point I want to make is we all understand, every one of us understands that people bring different perspectives to this issue. Some feel very, very strongly that masks are still needed. Some feel very, very strongly that masks are unnecessary. I ask everyone to be respectful of the range of opinions and the circumstances that exist. But we need to remember that COVID-19 is still here. And if there's one message that we've gotten over the last week, it's how powerful and effective the vaccinations have been. Unfortunately, there are still quite a number of people who are not vaccinated, whether by choice or because of age or medical condition or politics. So if a store says its patrons should wear a mask, we all need to respect that. This is about respect. It's pretty basic stuff. We need to respect that. But I want to emphasize again, we have gotten to this point, and CDC made this surprise announcement, I think in large part because of the incredible effectiveness of the vaccination. And I know there's still a lot of people sitting on the fence, and there's some people who are opposed to it. We have gotten to where we are today, which I think is an incredibly important step forward because of those individuals who have gotten vaccinated and because of the success of those vaccinations. So if anyone is looking for proof about the effectiveness of these vaccinations, it is staring you right in the face, and it is the reason that the CDC has revamped its views. I also want to make the point that the city continues to offer quick, easy, and free vaccinations for Milwaukee residents at the Wisconsin Center and at the Northwest and South Side Health Centers. Vaccinations are available at the Wisconsin Center Monday through Friday, 9 a.m. to 5:30 p.m., and Saturdays, 9 a.m. to 3:30 p.m. through Friday, May 28th. Beginning this week, as we attempt to bring vaccinations even closer to people in their neighborhoods, walk-in vaccinations are now also available for the public at 3 Milwaukee Public Library locations. Zablocki Library, located at 3501 West Oklahoma, and Washington Park Library at 2121 North Sherman Boulevard, Mondays from 1 to 5 p.m. and Wednesdays and Fridays from noon to 4 p.m. On the south side, another location is Mitchell Street Library, which is located at 906 West Historic Mitchell Street. That location will have vaccinations Tuesdays and Thursdays from noon to 4 p.m. Also, beginning this week, I'm very, very pleased to announce that 5 Milwaukee Public Schools will be hosting vaccination clinics from 11 a.m. at the following locations on select days of the week. Morris Middle School on Monday and Wednesday, Rogers Street Academy on Monday and Friday, Roosevelt Middle School on Wednesday and Friday, North Division High School on Tuesday and Thursday, and South Division High School on Tuesday and Thursday. These clinics will help us in vaccinating the newly eligible 12 to 15-year-olds, but will also be open to all members of the public. And it's our hope that the young people, the 12 to 50-year-olds, will bring their parents or their grandparents or their aunts or uncles to get the vaccinations as well. And we continue to work with our faith community on getting vaccine out in the community. This weekend, vaccinations will be taking place at New Direction Church, led by Pastor Eugene Cowan, located at 2127 West Garfield Avenue on Saturday, May 22nd from 10 a.m. till noon. At Canaan Missionary Baptist Church, led by Pastor Fred Jones, located at 2964 North 11th Street on Saturday, May 22nd from 10 a.m. to noon. Finally, I also want to remind residents to continue to take advantage of COVID-19 testing to keep our community safe. It is very important that we continue our testing efforts, even as we see our numbers dropping. We need to keep tracking and observing how the disease is spreading in our community throughout every step of the pandemic. Just as the vaccinations are free, the testing is free. Free community testing is available for anyone, regardless of symptoms, and it's available at American Family Field on Monday, Wednesday, and Friday, as well as Saturday from 9 a.m. to 3 p.m. And again at the Northwest and Southside Health Centers, Monday through Saturday from 9 a.m. to 2 p.m. Receiving a test is free and easy. So, as good as the news has been, please, please, please do not let your guard down. Please get tested if you're feeling symptomatic or you think that you may have been exposed to someone who has tested positive for COVID-19. And if you haven't gotten the shot, get the shot. Get the shot. It works, and it will help you and help the people in your family and this community who you care about. And with that, I will turn it over to Dr. Weston. Dr. Weston.
All right. Thank you, Mr. Mayor. Good afternoon. First, to our numbers, we are currently seeing an average of 77 new cases a day and about 1 death every 3 days. We continue to have encouraging gradual downtrends across the board in our burden of disease. So we've seen many opinions on the released CDC guidelines that fully vaccinated people would be safe to unmask in many public situations. However, a lot of questions still remain. The fact of the matter is that the science behind the guideline change is solid. The vaccines have been given to over 150 million people in the United States. That's an incredible number of people in the history of any drug or any vaccine to understand the effectiveness and safety. And in those 150 million people, the vaccine has been proven to be incredibly effective and safe. And that effectiveness, importantly, the near 100% effectiveness of all the vaccines in preventing hospitalization and death from COVID led to these new recommendations. Moreover, an increasingly robust body of research is demonstrating that those who are vaccinated have a low likelihood of transmitting the virus, even if they do happen to become infected. So these findings together support the fact that those who are vaccinated are highly protected against COVID and can reasonably unmask in many public settings. However, that's only half the story. While these recommendations are appropriate on the individual level for those who are vaccinated, we must consider the broader public health of our specific community. So in Milwaukee County, we're still in a state of high disease activity, as defined by the DHS definitions. Now, at the same time, we're at only 43% of our county population having received at least 1 dose of vaccine. Now, the good news is that both of these numbers are moving in the right directions. Cases are decreasing while vaccinations are increasing. The challenge is that we still have a ways to go. In our community in particular, with these rates of disease and rates of vaccination continuing to mass, particularly in public, more crowded indoor situations where you're not able to tell who's vaccinated and who is not, is still the safest practice. Doing otherwise can make these situations less safe for many groups. So while the data shows that those who are vaccinated are likely safe to be unmasked in a small store, for example, having those who are not vaccinated also unmasked makes that store less safe for other populations. Now, this includes children who can't yet get vaccinated, particularly young children who also may not be able to mask, people who are immunocompromised, and the small but very real subset of people who may not be able to get vaccinated, such as those undergoing certain cancer treatments. Now, these are the challenges that we as communities and individuals face as we're in this transition period before vaccine eligibility expands to all age groups and before vaccination rates reach a higher level. But make no mistake, we are seeing progress. We're seeing the true benefits of vaccination. And as we see higher rates of vaccination in our community, we'll continue to see our disease burden fall. And each of these will lead to the stepwise, purposeful, and responsible return to normal. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. Our goal when making decisions throughout this entire pandemic has always been to do the most good for the most people and protect our vulnerable populations. We've listened to the infectious disease experts and epidemiologists, followed the science, and closely aligned with the CDC's recommendations and guidance. And that's what we will continue to do going forward. The science shows us that fully vaccinated people are safe to be in public without wearing a mask. The evidence around this is indisputable, but I want to be very clear. Being unmasked indoors in public is for fully vaccinated individuals only. Fully vaccinated by the CDC's guidelines refers to individuals who are 2 weeks past their second dose of Pfizer or Moderna, or past their single dose for Johnson & Johnson. Unvaccinated individuals and children under the age of 12 should wear masks when in public to keep themselves and their community safe. Data from UW Health shows that unvaccinated individuals have a 1 in 10 chance of contracting COVID-19, and masks are an effective way to keep you safe. With the expiration of the health order on June 1st, vaccinations become even more important. The city of Milwaukee has been averaging an approximate 4% increase in vaccination each week, and we need to see this number continue to grow. Milwaukee has more than enough supply of vaccine for anyone who wants to receive theirs. Our vaccination clinics don't require an appointment, and we're hosting mobile vaccination clinics throughout the city every day. If you want to unmask, you must get your vaccine. You can find more information on vaccine and upcoming clinics at milwaukee.gov/COVIDvax or healthymke.com. Going forward, the Milwaukee Health Department will continue to be a resource for businesses as they determine their best policies for their staff and guests. We trust local organizations to know their customer base and that they will make decisions with that knowledge in mind. We support businesses who choose to keep the mask policies in place or capacity limits in place, and the public really needs to be respectful of each business's decisions. Week over week, we have seen our burden and test positivity decrease and our vaccination rates go up. The work our community has done to keep us moving in the right direction has not gone unnoticed, and we are only at this point because of that work and the commitment to public health and safety. Thank you.
Thank you, Commissioner Johnson. We'll now move to the media portion of our briefing. Just a reminder, following this media Q&A, we will also have a Spanish language portion of the briefing, so please stay on if you are interested. Our first questions come from Allison Durr with the Milwaukee Journal-Sentinel, and the first one is for Commissioner Johnson. Before the mask mandate and health order expire, will the health department continue to enforce them, including finding businesses?
Yes, our intention is to continue the same process we've been going through for the last few months, which is we have an inspector that goes out. If he sees any violation, it will be reviewed internally by the health department.
Our next question from Allison Durr is for the city and county. When will the city and county return to holding council board meetings so residents can more easily attend? And when will the offices at the city hall and courthouse, where residents have traditionally come to county services, fully reopen?
I don't know if the mayor wanted to take that, but I will jump in.
I'll let you do county first, and I'll come in for city afterwards. So,
all right. So the first
Mr.
question
County
is related to board meetings. I don't have any authority over the board meetings. That is more of a question for the chairwoman of the Milwaukee County Board. But when you think about services that are operated here within the county courthouse, many of those services are open and have been open, so people can come here. If it is not open, it's probably not under our jurisdiction and maybe under another constitutional officer.
I can tell you again, just as the county board has jurisdiction over its meetings, the common council here will decide when it will resume its activities in person. In terms of the mayor's office and in terms of City Hall in general, I anticipate that there will be a lot more, and the mayor's office included, will be opening sometime during the month of June. So we are just finalizing right now what the plans will be for that. But I anticipate you'll see a lot more activity in June.
Thank you both. The next question is from Ben Wagner with WISN 12. He's asking, and this is for maybe either of our officials on the call, is there any concern that businesses which decide to require masks after June 1st could face backlash from customers?
I anticipate that all businesses pretty much know their customer base, know the individuals who come to visit them, and they will make a decision that they think is, from a health perspective, hopefully, and obviously from a business perspective, what makes the most sense. So again, what I'm asking is people be respectful of other individuals and the decisions that they make.
The next question is, how many students have been vaccinated at NPS clinics so far? And any idea how many 12 to 15-year-olds have been vaccinated since being given CDC approval?
So I actually can't answer that question, but I'm going to find out hopefully while we're still on this call.
All right, thank you. The next question is from Allison Durr with the Milwaukee Journal-Sentinel. She's asking, there has been continued conversation about the racial disparities in the vaccination rates. As the health orders lift, how are local officials thinking about what the impact could be on communities that have lower vaccination rates?
I can tell you this is one of the issues that we discussed when we crafted the path forward, whether we should be tying it to a vaccination rate, whether we should be tying it to a disease burden rate. And we felt that that might be counterproductive. But every time I get an opportunity to speak on this issue, including yesterday when I was at a community event, I tried to make the point to individuals that vaccinations are available throughout the city, because I am very mindful that we continue to have this racial disparity in who is getting vaccinated, and that is a major concern of mine. And so I want people to get vaccinated. We're going to continue to have outreach efforts, particularly in those areas where we're seeing lower vaccination rates.
Thank you, Mayor. Sharon Bajenda with CBS 58 is wondering, does the B1617 variant detected in India pose a threat to our community? And do you think vaccines will protect well against this variant?
So that variant and other similar variants that are developing in India certainly pose a risk to our community. We've seen that with the B117 variant that started in the UK is now far and away the dominant variant in Wisconsin as well as the United States. So when a variant gets an advantage, whether it's increased transmissibility, increased severity of illness, or the ability to evade the immune system, that advantage for the virus helps it to spread. And that certainly is a disadvantage for us. So any variant of concern that is developing is something to keep an eye on. But so far, it does look like the vaccines have been effective against all the variants. Some varying levels of effectiveness, but overall quite effective still.
I'll give it just one more minute for a few more questions. It looks like Allison Durr with the Milwaukee Journal-Sentinel has a few follow-up questions. For Commissioner Johnson, could you explain the rationale behind continuing to enforce the health orders for the next 2 weeks? I could see some feelings that the fines, potentially thousands of dollars, are unjustified at this point, given the new federal guidance.
Yes, I think we're really thinking more about less around the enforcement and finding and more about this is an opportunity over the next 2 weeks to encourage businesses to continue masking and really just address any sort of egregious behavior. So it certainly is not our intention to be punitive. We really just see this as an opportunity. We have 2 weeks to make sure that we're doing things correctly and that our businesses and our community is safe. And so that's why we're continuing to do the inspections.
So for the next 2 weeks, the emphasis is going to shift to education and re-education.
The next question from Tony Atkins is for Commissioner Johnson. He's wondering, Tony Atkins with TMJ4 is wondering, will the expiring public health order also include restrictions on mass gatherings?
Yes, so the public health order in its entirety will be expired on June 1st.
Sari Lesk with the Milwaukee Business Journal is wondering, given the racial disparities in vaccination rates and the factors Dr. Weston described in masking considerations, could you elaborate on why you feel comfortable moving the city forward without a mask mandate?
Yes, I think the challenge we're really faced, and again, we have been following the CDC guidance. I am very confident that the CDC's science that they've made their informed decision on around individuals who are vaccinated can be in public without a mask on, makes it very difficult to have a mask mandate or order that is only for individuals who are unvaccinated. It's really just put us in a position where we've had to make the best decision we can for our community and for our city. And we are very hopeful this incentivizes people who are unvaccinated to get vaccinated.
The key word there, I think, is incentivize, because we want to make sure that individuals have access to these vaccinations. And we don't want to create a scenario where it's counterproductive, that any type of order will discourage people from being vaccinated. So the message that you're going to hear from me and from the commissioner and from others is going to be centered around the importance of being vaccinated for yourself, for your family, and for our community.
And I also want to add, again, the CDC guidance for vaccinated individuals is for public spaces, so indoor, but it excludes schools, congregate living settings, medical centers. So all of those locations still, it's highly recommended, regardless of your vaccination status, that you are masked.
Chuck Kornbach with WUWM is wondering, will Milwaukee be ahead of the Milwaukee County suburbs with a June 1st change, or behind in lifting the mask requirement?
I think there's some variability in the different municipalities and when they are each modifying their masking requirements.
I'm sort of biased, but I think the city's always ahead of the suburbs in good things and behind them in the bad things. But it's sort of a mixed bag here. But we're all going to probably be acting in accordance in the near future.
Thank you, Commissioner, for chatting those numbers. I believe that was for Ben Wagner's question. The next question is from Sari Lesk with the Milwaukee Business Journal. How will the city handle people who are unvaccinated? We presumably won't know if unmasked people are vaccinated. And is there any enforcement mechanism for this?
And therein lies the challenge that we're faced with. It's incredibly, there is no way for us to know. It's really we are trusting individuals, residents in the city of Milwaukee to be honest and to wear a mask if they are unvaccinated. Again, really encouraging people who are unvaccinated to be vaccinated so they can be unmasked safely. And then if individuals have to weigh their own comfort level and their own risk, their comfort with the level of risk that they're facing when they're in public. So even if you are vaccinated and you're uncomfortable, you should continue to be masked.
Those appear to be all the questions I'm seeing in the chat. I'll pause for just a minute. Again, we do have that Spanish language portion of the briefing. So for those outlets who are not interested in that portion of the briefing, feel free to drop off. We'll give it just a minute and then I'll introduce our interpreter.